A professional counselor in the Dallas area is growing in popularity for his treatment methods.
How do you talk to kids about terror? And with social media and television, it's everywhere, and it's unavoidable for kids.
Rusty Lozano is the founder of the Center for Biofeedback and Behavior Therapy. He's also been nationally recognized for his work with brain mapping.
He's created a gym to work out the mind. His office features an obstacle course.
Rusty Lozano is a licensed professional counselor, helping children with headaches, with anxiety, ADHD, and more.
Here's where Lozano comes in. He teaches kids how to think their pain away with something called biofeedback.
A North Texas therapist is treating patients in this unconventional way.
We have Rusty Lozano who's joining us today. He's a licensed professional counselor.
He put together an unusual treatment for teenagers who are struggling with mental issues, except he's taking this now a step further.
Rusty Lozano, a leading therapist and pediatric biofeedback therapist based in Texas at the Center for Biofeedback and Behavior Therapy. And Rusty, thanks for being with us tonight.
Rusty Lozano, a father of 4 and also a professional counselor in Texas, says it's all about being a credible resource to your children.
The Therapy Hour with Rusty Lozano, your dedicated resource for mental health news, views, and tips you can use. Brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas. And now, here's Rusty.
Good afternoon, and welcome to the Therapy Hour, brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas. The Center for Biofeedback and Behavior Therapy is a comprehensive biofeedback clinic that works on pain management, works on behavioral issues, and also returning back to work after injury and pain conditions. So this topic today is actually very relevant to all of us. We're going to be discussing neck and back pain with the Spine Team Texas group. But let me read you something about a study that I read up on in the National Institute of Health, and it says that the National Institute of Health indicates that 80% of adults experience low back pain at some point in their lifetime. It's the most common cause of job-related disabilities and a leading contributor to missed work days. In a large survey, more than a quarter of adults reported experiencing low back pain during the past 3 months. Men and women are equally affected by low back pain, which can range in intensity from a dull, constant ache to sudden sharp sensations that leave the person incapacitated. Pain can begin abruptly as a result of an accident or lifting something heavy, or it can develop over time due to age-related changes in the spine. The study further indicates some of the common mechanical types of pain, and some of these may sound really familiar to you. The common types of mechanical pain are sprains and strains, intervertebral disc degeneration, herniated or ruptured disc, radiculopathy due to compressed discs, sciatica, slip disc, traumatic injury, spinal stenosis, skeletal irregularities. Here to talk to us more about neck and back pain treatments are our guests from the Spine Team Texas group. David Garrigas, MD. He specializes in physical medicine and rehab. Anthony Berg, MD. He is a spine pain anesthesiologist. And Leonard Kabuli, MD. He's an orthopedic spine surgeon. And the executive director of marketing, Andrea Basica. So our show has 4 segments today. The first segment, we will discuss the general overview of the Spine Team Texas model. The second segment, why this organization landed in Texas, its unique model, and how it's different. What specialists make up the comprehensive team, expansion and growth over the last decade. The third, we will get to know these 3 specialists. And that's a really important part of this show. There are a lot of great specialists out there, but people, it takes a lot of homework to really find who they are and where they are. So I really enjoy this particular type of segment, getting to know them and how they're instrumental in the practice and cutting-edge treatments each offers in neck and back pain. The fourth segment, we're going to open up the phone lines and talk to the doc. Call in with questions for these specialists. The phone line is 214-866-8400. That's the guest line at 214-866-8400. So here to kind of talk about this topic and get things rolling is David Garrigas. He specializes in physical medicine and rehab. Welcome to the show, David.
Good afternoon.
Well, you see a lot of these individuals who actually work with different types of. You see a lot of pain conditions in your clinic, yes?
Absolutely. Most patients that come and see me either have problems with their neck, their back, buttock, legs, arms, and our job is essentially to sort through all the potential sources of the pain and figure out a treatment plan that expedite their recovery and return them back to their life.
And so your common individual that you see, are you seeing more injuries? Are you seeing more?
I would say probably the majority of patients are weekend warriors that get injured, minor sprains and slip disc and things like that. And then you have some patients that injure themselves at work and some that have just regular arthritis, and little by little, as a result of gaining weight and maybe not being as active as they should, then little by little things start becoming symptomatic, and they decide to get treated.
That's interesting. And you see a lot of that. And I want to actually just chime into with just a little bit of, you just kind of give us a little intro to who you are. Anthony Berg, spine team anesthesiologist. Tell us a little bit about what you do at Spine Team.
Yeah, so as we work together as a team, each of us has a different role, if you will, to bring to the part. And what I really focus on in my training is the management of people that have chronic conditions of pain. Those that have had pain not just for a few days, of which I do treat, but those who have been afflicted, if you will, with a chronic status of pain, this back pain that has been going on for many years or even decades. And those are the patients that I kind of focus on in my own practice.
Fantastic. And you see a variety of different patients and different age variances, correct?
We do. You know, we see mostly adults, but certainly what I think is most interesting is people think that all I do is see old folks. And in fact, that's not the case. I would say about 30% of my people are over 65. So in fact, most patients that have back pain are your typical just working age adult.
Working age adult, and then something just kind of happens, and all of a sudden they can't figure out their back pain, and they're consistently living with it. And so then they're looking at different types of treatment options.
That's exactly right. You know, I think in fact, it is a rare thing for somebody to come in with a really good story as to why their back hurts. It's usually just kind of insidious and onset. I mean, even in my own life, I was actually seeing Dr. Garrigas the other day. I had just rolled out of bed with my kid. I was reading her a book, and for about 2 weeks, my back was killing me. And again, not a very good story. And I think that's the more typical thing, is that people are just doing their normal thing and their back begins to hurt, and then over time develops into this chronic condition which really afflicts them.
I see. And there's no battle story there. It's just
there's no battle story.
Something as simple as that, right? And then we have Leonard Kabuli, orthopedic spine surgeon. Tell us a little bit about how you work with the Spine Team Texas group.
Well, Rusty, thanks for having us today. You know, our model here at Spine Team Texas is really to bring a lot of specialties in together and under one roof. So we've got Dr. Garrigas, who's our physical medicine rehab specialist, who specializes in taking care of these patients in a non-surgical manner. Dr. Berg, he's also our anesthesia pain specialist, does the same. And a good majority of the patients that we see within our practice, a majority of them actually don't need operative treatment. We can manage them non-surgically. Only about 8%, at most 10% of patients that we see within our practice will actually need to see me and will need an operative treatment. And so that's where I step in. So if you have a condition that can't be treated non-surgically, if we can't treat you with medication or anti-inflammatory medication or even injections or some other non-surgical method, then they'll typically see me.
So you become the last resort. The last resort to treatment after other interventions have been implemented and they're not necessarily working.
Absolutely, and that's the beauty of our organization is when you come in to see us, our first inclination is not to cut on you. We really want our patients to get back into the community, be functional members of the community through these non-surgical means as best as we can. But if we need to operate on these patients, then we try and employ minimally invasive procedures in order to get them back functional into the community with little or no pain.
And that makes a phenomenal approach. You have frontline. It's almost like you have several segments before you get to that initial or the final surgery, if need be.
Absolutely.
Let's talk about the overview of the Spine Team Texas model. So you start with somebody comes in for a consultation, and they visit with the physical pain and rehab department first.
Yep. Yeah. So, patients, when they come and see us, the last thing that they want to hear is that they're going to need an injection or they're going to need surgery. And we understand that. And we've designed our model to respect that and to work within patients' belief system and lifestyle. If somebody tells me they don't want to have surgery or they don't want to have an injection, or some tell me they don't want to exercise, we have to kind of work within that model, and we have to offer them treatment that will help them and get them over their particular situation in an effective way, and without using therapies that they would not like.
And that's a great first line. Ladies and gentlemen, if you're just joining us, we're speaking with the Spine Team Texas group. We're going to take a commercial break. We'll be right back after these messages.
You're listening to the Therapy Hour with Rusty Lozano, brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas.
We're back. If you're just joining us, we're visiting with the Spine Team Texas group, and we're discussing back pain and neck pain, and also we're discussing a little bit about this practice. It's very unique. This next segment, we're going to talk about why this organization landed in Texas, its unique model, and how different it is. It's very different, is what I'm assuming. What specialists make up the comprehensive team in expansion and growth over the last decade. So here to talk to us a little bit more about that, Anthony Berg. So tell us a little bit about what this model is about, and tell us why. First of all, if you landed in Texas, where are you guys from, and what is this organization about?
Yeah, so this is an interesting story. So I myself am from Texas, but if we look back historically, our two founders, Dr. David Rothbar and Juan Bartolome, were colleagues together as residents, as neurosurgeons, and they really had this dream to change the model of traditional back care. And I think to best illustrate that, let's talk about traditional back care. So in traditional back care, what you would do is, maybe you have back pain and you see your family doctor and they send you to a spine surgeon, a neurosurgeon. And they may look at you, do some studies, and determine, you know what, first, let's try some other things. So I'm going to send you over and see Dr. X over here. And then you call them, you wait 3 or 4 weeks or a month or longer, you go see them. And then maybe they do what they can offer. And then they say, well, we also want you to do some physical therapy. So let's send you over to, therapy office Y. Now, the problem here is as a physician, one of the things that we combat is that when patients get treatment, they come to us and we don't really know what they had done. And so we're often saying, Rusty, what did the doc tell you? Mm-hmm. What did they do for you? I don't know. They did this injection. Where? Why? Of what? And that becomes challenging. And so when Dr. Rothbart and Bartolome founded the group, they wanted to evolve that to where all the different specialties and ancillary services needed to treat back pain was together. So here we have surgeons, orthosurgeons, spine surgeons, neurosurgeons. We have physiatrists who specialize in the management of physical medicine. We have anesthesiologists such as myself and physical therapists all at one location. So, number one, you can get all your care in one place. But for me as a physician, number two, the communication between each of these things leads to much better outcomes because we know exactly what's been done, what's worked, and what hasn't.
It's all been in-house.
Exactly.
And so it kind of really minimizes having to go to different operations. Like if you go to one specialist for one thing, then they may recommend something else, and so they'll recommend somebody else. So having it in-house, like essentially what this individual has been going through and what their treatments have been.
Exactly, and we can expedite care. I think of a patient the other day who came and saw me. I immediately recognized this person, unfortunately, would not benefit from a conservative management because they had a severe neural injury. I immediately just walked out and grabbed my partner, Dr. Kapuli, who can then walk right in and facilitate their care. almost instantly.
That's actually really, it's a phenomenal approach. I mean, knowing that you just have that specialist there and you can walk over and there's a need for it and he's right at your disposal.
Exactly.
And to Anthony's point, some of these conditions really need to be treated in a very timely manner. If you have a patient who has a deficit who can't walk or who can't lift up their arm, I mean, the seconds really do matter. I mean, it's the difference between having permanent injury and having the ability to walk without pain or having the ability to walk, period. So our institution or our model, I think, is very beneficial to the community because it allows us to basically cut out time and in some instances even cut out the middleman, so to speak, and really get to the root of the problem and get that problem fixed as quickly as possible.
And I would think that would actually create a lot of trust with your patients because, you're talking about pretty substantial symptoms that are life debilitating and they're panicking, they're afraid,
sure.
And they need answers. I mean, you think about what it'd be like to have, would it be like to need an answer
sure.
and not being able to sleep and waiting for that appointment to come. But you have this particular
sure.
model where you have everybody in-house. And they're there to address these things almost
sure.
immediately.
And the beauty of what we do is, as I'd mentioned before, it doesn't mean that when you see us that the solution is going to be something operative. Mm-hmm. We've had a number of patients who've come in and who have had really debilitating pain and have been unable to get out of bed and do their everyday activities. And sure enough, we're able to diagnose their issues. If they need to have physical therapy, we have that in-house within our organization as well. And our specialists do a phenomenal job. Our physical therapists do a great job because we really are focused in treating those patients who have issues with their neck and back. We're not, which isn't necessarily a bad thing if you treat other ailments, but we believe that focusing on back and neck pain issues really needs a focused approach.
Focused approach and not necessarily just a cookie cutter one perspective. I mean, you have like different things that you're different perspectives, different
sure.
opinions. You even have a physical therapist on staff.
Absolutely. I mean, one of the beautiful things that we in our organization do is we have the ability to talk to each other. We have the ability to, step across the hall and I can find my colleagues, our anesthesia pain specialists, and say, hey, what do you think about this guy? Do you think they would benefit from an injection? Do you think they would benefit from something other than a surgical treatment? When I came to Spine Team Texas approximately 6 years ago, I was looking for that type of a model. I wanted to be involved in an organization where everything was under one roof. And this organization also has the ability to, go beyond just doing clinical work. We also do research within our organization. We have conferences where our specialists sit down across the table and discuss cases of interest or cases that may have been difficult to treat in a clinical fashion. So that communication, I think, is key to excellent patient care.
And very essential in the sense that you have everybody in this it's all under one umbrella. So are there very many practices like this that you're aware of that that have this kind of component?
So, the old model of a multidisciplinary center is you have several providers from different specialty under one roof, but that don't really communicate together. They're essentially functioning as independent providers. And the key difference within our model and that model is the communication. We have spine conferences on a weekly basis, and we really review all the patients that either have not had optimal treatment from the initial, whether it was physical therapy or an injection. If they didn't respond as expected, their case will be reviewed. If it's somebody that has difficult condition or imaging that is difficult to interpret and whatnot, we have 15 providers. We've all trained in different parts of the country. We all look at things a little bit differently, and that puts 15 brains essentially looking at your particular case.
It's a lot of eyes, for sure.
It's like getting 15 opinions or 15 consults, all by coming to one organization, and that's phenomenal.
And that almost, if you think about like conventional research, you need a peer review to make it a substantial result. And so having 15 opinions, I mean, that would mean that you have a incredible amount of filtering before a decision is made or an outcome is actually prognosis and any sort of surgical procedures. So that's a really amazing concept. So you guys have grown over the last decade, yes?
Absolutely. Allen is our 6th location, and we started in Southlake, and we have a location in Bedford and Fort Worth and Rockwall, Richardson, and now in Allen.
Wow, and so how many doctors collectively?
15 plus mid-levels and physical therapists, and so there's.
You're talking
I'm
about
not actually sure the
easily
total number, but probably around 25 total providers.
Wow, that's a pretty magnanimous amount of people. When you think about like let's go back to the whole psychology of pain. Do you think that it's important for people to really not try to muscle through and really think that that their condition is going to be so debilitating that they can't do anything, so they just kind of live through it? I mean, would you recommend that people seek out like treatment sooner than later?
Absolutely. So we know that it takes about 3 to 6 months for permanent changes in the nervous system to take place. Mm-hmm. And so really that's kind of the time frame. And you know, if you've had pain that it's been there for 3 to 6 months, then there's a chance that your recovery might not be full. And so you want to take a proactive approach to this and seek out help. And it's nice to know that, I think some of the fears that patients have is that they go and see a spine group and they're going to get an injection or surgery. Mm-hmm. And the benefit of our group is that that's probably not the case. And you can have the ability to seek out care earlier in your problem without the fear that you're going to have excessive care.
Excessive surgeries. And you yourself, actually, we connected first because you were thinking outside the box and you actually found our Biofeedback Center and had made that recommendation for a patient.
Absolutely, Rusty. So, we are a medical group, but we partner with, outside providers because of our conservative approach. So we commonly partner with community acupuncturists, massage therapists, chiropractors, biofed practitioners, chronic pain psychologists, and that's all within kind of our model.
So just to reinforce that when you go in and you seek consultation from a medical physician regarding your symptoms, it's not going to equal surgery. And so to not be afraid, to actually go and seek this out. I want to open up the phone lines for our 4th segment, so I want to put this number out there, 214-866-8400. Our 4th segment is going to be Talk to the Doc. We're visiting with the Spine Team Texas group, and I'm actually learning quite a bit. You guys are a pretty phenomenal group, and I'm really, really happy to have you here. We'll be right back after these messages.
You're listening to the Therapy Hour with Rusty Lozano, brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas.
We're back. And if you're just joining us, we're visiting with the Spine Team Texas group. These guys are really awesome. Over the commercial break, we were talking a little bit about treatments and furthering the conversation about people and their hesitancy to call. And Dr. Kabula, you made a pretty interesting comment. You said that your goal, a lot of times your goal is to get people off the meds.
Absolutely. I mean, as we mentioned, having back and neck issues is very common in the developed world. Unfortunately, the treatments for these issues, have evolved over time. One of those treatments has been the use of pain medication. And although pain medication can be used successfully in a lot of patients who have acute issues and acute pain, unfortunately, there are also instances when a lot of those patients will become dependent upon those medications. And so you have to have a group of individuals who are qualified and who know how to manage those medications and really try and get those medications to a kind of a reasonable level. in our practice, our goal is not to, push these medications on patients who absolutely don't need them. Our goal is to actually get patients better, to get them off those medications, to get them living independently from those pain medications. And fortunately enough, we have a group of individuals who are specialized in doing that. They've trained for years and years in their particular specialties in order to try and introduce other alternatives, such as spinal cord stimulators or the use of injections or even ablative procedures.
I had just had a patient this last week that came in, and she was terrified. She has this side pain, and she's been to several physicians, and they can't figure out what's really going on with her. So she came in, and she said that they'd given her a prescription for Oxycontin, and so then she was kind of feeling a little grim about the outcome of her future. It's like, is this what I'm going to have to do now at this point? But that's not really what this is about. This is about looking at several different concepts and implementing them. And so you guys working together along with your crew really make this an interesting approach. And like the 15 perspectives from the 15 doctors, and that somebody has to have a fresh perspective. If you have that many high IQ heads in the room, it's going to actually be there's some resolve. This next segment, let's get to know you guys a little bit and how you're really instrumental to the practice, because it's not only your medical training that's gotten you here, but it's also like your intuitiveness, your instinct, your prowess to go in and explore and take a chance on things. So what I want to do is maybe just talk a little bit about how you guys are really instrumental to this practice. But who are you? I mean, David, I've had conversations with you on the phone, and you were very concerned about your patient, and you've taken the time to actually call me. You and I spoke, and we were talking about this approach for your patient. But what led you to believe that that's actually that was a good thing for you to do?
Well, I'm a physiatrist by training, or a physical medicine and rehabilitation specialist. It's somewhat of a lesser-known medical specialty. It's certainly the youngest field of medicine. It was only created in 1947, and largely as a result of all the injured, wounded veterans out of the world wars, and requiring prolonged treatment to recover from their injuries. We are neuromusculoskeletal specialists, so we have expertise in brain, spine, nerves, muscles, bone, tendons, joints, and our expertise is really at designing comprehensive, patient-centered rehabilitation programs, and our real focus is on quality of life and function, and that's always the end result for me. I'm most interested in patients' function and their quality of life, and all my treatment plans are geared at restoring that.
And the treatment plans then would actually include, also using operations like, acupuncture or biofeedback or physical therapy.
So I'm a medical doctor now, but I actually started within the healthcare field as a chiropractor. So my treatment is, my approach is really broad. I have expertise in manual therapy and manipulation and soft tissue techniques and biomechanics. But also now with my medical background, obviously in pharmacology, physical medicine, rehab, and advanced spinal procedures, and that I basically group it with what's outside of mainstream medicine, which are things like acupuncture, biofeedback, and massage therapy, and things like that, all to help patients get back to their life.
That's fantastic. Anthony, how does your role play in this as a pain anesthesiologist, spine pain anesthesiologist?
Yeah, so this is interesting because a lot of people think, oh, you're an anesthesiologist. Are you going to be the person putting me to sleep for Dr. Kabuli? Well, the answer is actually no. And how people come in to manage pain is quite interesting. And one of the prominent specialties is to become an anesthesiologist first and kind of do the traditional anesthesia thing, but then to do additional training to manage people in pain. Obviously, as an anesthesiologist, we have great understanding of pharmacology and pharmacokinetics and how drugs actually work on people, as well as because anesthesiologists are very adept at doing injections and placing medications in very specific places very safely, that's kind of how those people tend to evolve into the management of chronic pain. And so some of my approaches and the things that I bring are I do the injections often. I also do more advanced techniques such as devices called spinal cord stimulators, which target the management of chronic pain in a different fashion, which we can discuss if you'd like. And so that's kind of the role I bring in a, if you will, non-operative setting.
How about you, Leonard? As the surgeon, is it always surgery?
Well, I'm going to take it back a little bit further for myself, Rusty. You know, actually, before I got my medical degree, I was actually an electrical engineer, and so I started off, you know, in engineering, and that really kind of catapulted me into medicine because of all the various technologies and things that are being used in medicine in order to treat patients. And so I am actually an orthopedic spine surgeon. So my training background is actually in orthopedics and the treatment of musculoskeletal problems with surgery. And then you study that for approximately 5 years, and then you do an additional 1 year training in order to really specialize in the disorders dealing with spine issues and spine pain. And so the beauty about spine over the past, say, several decades is that all these technologies that have been kind of been worked on in the industry are actually hitting the spinal, I guess the spinal continuum, so to speak. There are a lot of different technological advances within spine surgery that allow us to do our work and to do it efficiently, utilizing very small incisions and to get patients back to work and back to productivity quickly.
Are you seeing a lot of nanotechnologies that are being implemented these days with spinal surgery?
You know, I think that type of technology is probably many, many decades away, but there is a lot of active research that's being done utilizing nanotechnology. And I got to tell you, I'm excited about what's around the corner.
It's really amazing. It's almost like it seems like it's Terminator or something when you think about like the extent of what we're able to do with the body. And that's actually, it makes it interesting because when you think, should people, when you think about surgery, is there a level of fear that people should have? I mean, is it a scary process?
Well, I think what should be feared is inactivity or not going to see your surgeon or going to see your physician. You know, what's unfortunate is a lot of patients will wait months or even years to go in and see a specialist to determine, hey, is this issue or this problem that I'm having, is it something that needs to be treated? And if so, how can it be treated? I've had a number of patients who've seen me over the years who've had an inability to walk because they have a foot drop because one of their nerves has been essentially almost, you know, injured permanently. But this is a situation that could have been addressed months or even weeks or even years prior. So I want to encourage patients or individuals who have any issues not to fear to go in and see their specialist, because there are a lot of procedures that we do nowadays that, number one, don't involve surgery. But if they do, they don't necessarily require a large incision or a large time off.
And it's not something that you should be completely afraid of. Did you want to say something?
Yeah, and you know, when I think about you know, when you asked about the specific role, one of the things that I've discovered over the years is that, you know, people become somewhat despondent about their situation because maybe they did try some things, and maybe those things were not successful. But over time, technologies have improved, techniques have been improved, things that did not exist now are mainstream. And I can't tell you how often people come in and have been treated in a traditional model, but with newer techniques are actually in a much better place, sometimes even in a curative place, when they've just been somewhat depressed about the situation, thinking there was no hope.
Yeah, and that learned helplessness or that loss of hope can essentially keep people, they can actually make their condition worse. And you see that maybe it increases anxiety or increases their inability to function, and they avoid these topics. They avoid going in to see the doctor, and it makes the fear and it makes the pain worse. What I see in my clinic is that when an individual is constantly focusing on their pain and they're worried about it, they shut down and they slowly start to, I guess, shut out the outside world until their life is just a little narrow path.
That's totally true. You know, people we actually, on all our patients, assess their level of depression and anxiety. And people wonder, why do we do that? Well, the reality is this. If you have chronic pain, it affects you. It affects your interactions with your spouse, with your children, with your friends. You lose friends, and it really can impact how you experience life.
So your quality of life is compromised, and it doesn't necessarily have to be so. We're going to take a commercial break. I want to open up the phone lines, 214-866-8400. Talk to the doc. Be back after these messages.
You're listening to the Therapy Hour with Rusty Lozano, brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas.
Hi, and we're back. And if you're just joining us, we're visiting with the Spine Team Texas group, and we're discussing back pain and neck pain and also these treatments. So what I want to do is open up the phone lines and welcome our guest onto the show. Hi, you're on the Therapy Hour with Rusty.
Yeah, great show. Interesting topics.
Thanks.
Got a question for you. I guess with all the doctors being housed, I guess, in the same office, do you guys talk to each other and then offer different options, or is it always usually going to one doctor and staying with that one doctor?
So, go ahead.
Yeah, so, when a patient comes in, the beauty of working with all our partners is that we actually become very adept at understanding what each other does. So I can even evaluate a patient as a non-surgeon knowing, let's say somebody has a really serious problem, and I know pretty much what we're going to do all the way down to the surgery, less doing the surgery. And so in a case like that, I just go get them and they can come in. Now, other cases, it may be, let's try something first, and then I'll have you follow up with the surgeon. And then there's other times where we actually go and we all walk into the room together.
So, and do they actually get, do these patients actually have their doctor? They're assigned a specific doctor when they come in?
They usually are, they end up seeing whoever is able to see them first to just expedite care.
Okay.
But I have to say, I'm not a surgeon, but I can be confident that if for some reason one of our surgeons end up seeing the patient first, they're not going to have a surgical plan. And it's just, the patient is going to end up being rerouted to the appropriate provider regardless.
Are you still with us?
Yes, I am.
Okay. Did you have another question?
Yeah, and in regards to that, so is it always whoever's available, or do you just kind of, when you call in, you just tell them your symptoms and they kind of go from there? And then I'll get off the line. Thanks, guys.
All right, thank you.
Yeah, I think to answer that question, obviously it kind of depends because a lot of patients are sent by doctors and they may be very specific. Hey, this person's got a very serious problem. And we have a triage mechanism to kind of go through some of the, there's some simple questions to help triage people to the right doctor. Now, obviously that can work well a lot of times, and sometimes it's not as good. But still, again, at the end of the day, if you really needed to see somebody different, you'll be sent to them.
Okay. We have another caller. So when you come in, let's say they come into the process, they're in this practice for the first time. What can they expect as far as what would be the first level of intervention? What would be their first step when they come into the practice?
Well, I think it depends on what they've had done.
Mm-hmm.
It depends on the severity of their symptoms. It depends on what their pathology is.
So do you kind of review their case and kind of get background information on what kind of experiences?
Yeah, correct. So, a typical scenario, which you really need to be doing, is first you take a very good history. Find out what's been going on, what they had done, what they're doing. The next thing is a physical exam. Figure out if there's any deficits. Mm-hmm. Because sometimes people actually have a weakness and they don't realize it. Okay.
Excellent.
And then imaging studies, and then determining.
Gotcha.
Which go.
Let's take another caller. Hi, you're on the Therapy Hour with Rusty.
Hi there. Gosh, what an interesting subject, and something that I think a lot of us deal with every day. Just fascinating. I have a question. It's about my mom. She never has back problems, but about a month ago, she had a situation where she started getting pains in her buttock area, and it went all the way down her leg. And she couldn't sit down or stand up. In fact, it was around her birthday time, and a lot of her friends took her out to eat, and she had to eat standing up at the restaurant. And she was laid in bed, bedridden for about 3 days. And I remember her telling me that she had like an emotional, just a disturbing experience, like right before this happened. I don't know if that's related to it or not. Can you just explain a little bit about maybe what happened to her? After 3 or 4 days, I think they gave her some, they took x-rays, no broken bones, nothing was wrong with her. And te dieron jeringas también, ¿no? And they gave her also some shots. Apparently there might have been cortisone shots, but for about a week. But she was better after that. But was wondering if you could explain a little bit about this phenomenon. This has happened to me as well, where I've had 2 or 3 days of not being able to get out of bed as well. And it's just a sudden onset, and then I get better after maybe taking prednisone or something like that. Thank you, fascinating subject. I'll take the answers off the air. Goodbye.
So the symptoms that you're describing sound to be what we commonly term radiculopathy, and that's usually a discomfort that occurs in the torso and then travels down a particular extremity. Now, you have to be very careful in saying that, hey, the cause of radiculopathy is just due to one particular etiology. Truth be told, there are patients or individuals who have very similar symptoms, and it may be just due to a muscle sprain or strain, and you just have immense pain that travels down the limb. So what typically happens when patients come in to see us, we will evaluate them, we'll take the history, and oftentimes if we find that there is either a deficit or something that's very specific, such as a radiculopathy, we may request further imaging. And a lot of times, also depending on the patient's age, you can often find such things such as arthritis or inflammation in and around the nerve, or more commonly, what most people think about is a herniated disc. So there's a chance that your mother may have had a herniated disc or something, or some acute etiology of her pain, such as a herniated disc, that may have irritated the nerve that travels down into that leg and caused her a great deal of discomfort. Now, what's also interesting is that in a lot of instances, even herniated discs oftentimes will get better on their own, or will get better with some of these conservative treatments that we've discussed here today, including the use of anti-inflammatory medication, or even getting an injection or a steroid, or even an oral steroid. So just because you have those symptoms doesn't necessarily imply or mean that you need to have something aggressive or a surgical intervention done in order to get those symptoms to get better.
And she's describing this, her mother standing up to eat. She's living with this. It sounds like she's really trying to muscle through this, and there's really no need to kind of live like that. Yeah,
absolutely. What we do when patients come in, and some of these issues that patients have been chronic as opposed to acute. There are ways of addressing a lot of those symptoms. Sometimes it may just, imply having that individual start with physical therapy and trying to really hone in on why it is that they're having pain. Is it a particular position that they're always putting themselves in? Is it a particular, activity that they're doing on a repetitive basis? And so some of these things can actually be managed with non-operative care, including physical therapy.
Gotcha. Let's take one more caller. Hi, you're on the Therapy Hour with Rusty.
Hi. I was just going to say that I have been to you guys. I've been to your South Lake office.
Oh, awesome.
And saw Dr. Garza, who I think is really good. But I was wondering, so I got injections, and how long do they last typically?
So that's very variable. And, we see anything from you having one injection and lasting for years if the problem is mild. There's a number of patients, for example, that I've injected that have done a single or maybe a couple of injections, and that lasted for several years. And then sometimes when problems are more severe, the nerve is pinched more, but sometimes these injections last few months, maybe 3 to 4 months. And from my perspective, if an injection lasts 3 to 4 months, it is still a good and adequate injection, and that can be repeated from time to time. But when injections start lasting less than that, in the orders of, maybe days, a few weeks, maybe a month, then that's just not good enough.
Yeah.
And that's when we start looking at other things,
That could be
other
something
options.
else that's kind of going on. And how can people find you guys? Let's talk a little bit about your practice and how they can actually get in touch with you. So your website is w.spineteamtexas. Andrea, why don't you give us a little bit of feedback? This is Andrea. This is the Executive Director of Marketing. Tell us a little bit about how they can find.
Yes, absolutely. Thanks, Rusty. Thanks again for having us on the show. So spineteamtexas.com. We have a very informative website with 3D animated videos to explain in detail about the most commonly seen diagnoses, surgical procedures that we do. Also, they can follow us socially on Facebook, Twitter, and YouTube. They can call us at 817-442-9300 or 972-772-9600.
And where are your locations throughout the Metroplex?
So we have 6 in total. South Lake is our flagship. We also have Rockwall, Fort Worth Alliance, Bedford, Richardson, and then our newly opened Allen location.
That's excellent. You guys are pretty nicely spread out. So we're going to hear more about Spine Team Texas. I bet you will over time. You've been listening to the Therapy Hour with Rusty Lozano. Join us next week on our show. And if you have any questions, please email me or go to my website at w.onlinebiofeedback or rusty@onlinebiofeedback. Thanks, and enjoy the rest of your weekend.